Hi, I'm PJ Ravnsborg from Walnut Creek Veterinary Clinic. Topic of the day today is about flea and tick preventions, heartworm preventions, and seasonal changes. So I get questions all the time from clients on should I stay on preventatives year-round or should I use them seasonally? There's two different broad categories. Flea and tick prevention, I believe we can use seasonal in our Omaha metro area because we don't have, obviously we have a good hard freeze. I have a fair amount of people that travel, they go to Florida, Phoenix, etc., and they need to be on those preventatives year-round. But when we're here in town, I like to talk about the bug season, which historically in our area is early on. We have more of a tick infestation that starts up as early as March, although we sometimes have it earlier than that. And ticks are really active in the Omaha metro area as it's kind of warming up in the spring months. As we get warm and hot, those hot months in June and July, they like to not be quite as active, and therefore we have a lot of fleas that come around and they get more active. Ironically, the most busy time of year when we have fleas is right now. It's when it's getting cold. And so fleas, like anything else, I tell clients all the time, they've been around since the dinosaur ages. They actually are getting more active because they've learned to survive. So they know they need someplace to be for the winter. So where do they go? They go to our pets. And so as they are traveling around the backyard, they jump on those pets, and then they unfortunately will get into your house, and then they will turn around and lay eggs and larvae, and then therefore difficult to get out of your house. So once we get past those first hard freezes, and we had one last week, and we're having them this week, so I think we can start talking about not having preventative, but we need to be on prevention until through this month. So let's call it December 1. So to make it an exact amount, there is no exact because there's such variables on the seasons, but I would tell you from about March till about November is when we need to be on flea and tick preventatives. The preventatives that we use and recommend here at Walnut Creek, one of them is Preventative, two is NexGard, and then we also use Effatix, and in our cats we use Revolution and EffaPro. And so two of those are prevented. The Preventative is an oral pill. It lasts for 12 weeks. Takes care of fleas and ticks during that period of time. So if we had a patient that had Preventative in the 1st of September, they're covered September, October, November. They're fine until December, so they're going to be just fine. But if they haven't had one, then we need to be able to be on one of those if that's what you're using. If we're on NexGard, which is monthly, we use that on a monthly basis. And if we had it this month, we're probably good not to have it in December 1. And then any of the topicals, some of the ones that you pick up over the counter, whatever they may be, a lot of them are frontline derived, so the active ingredient is fipronil. They are obviously still effective, and they work a month ahead also. So if we're on some of those preventatives, and of course the Effatix that we carry, which has fipronil and cyphenothrin in there, which is another one that helps with flea and tick. So there is a season to it. We don't recommend it year-round. We don't like to overdose medications if we can help it. We certainly want them to be protected though. So